I am an interventional cardiologist in San Diego and the director of the Wellness Committee for California ACC. And it is my pleasure today to introduce our guest speaker, Dr. Erika Austin, who will be talking to us about the cost and the responsibility of what we do in cardiovascular medicine every day. So, a little bit about Dr. Austin. She is a trauma, attachment, and nervous systems educator who specializes in working with physicians and leaders in high stakes environment. She is a physician who holds, sorry, she's not a physician, she's a PhD in sociology who holds advanced training in psychology and somatic based approaches. And she brings over a decade of experience working with physicians and other professionals who work in high stakes environments. Her work really bridges institutional culture with our professional identity, and she brings a systems level approach to clinical stress. She's held numerous leadership roles in academia and has served as the director for mental health systems at Headspace. Having personally worked with her, her work has really impacted how I show up in my job day to day, and I'm excited for this opportunity for her to share her work and her experience with us and bring this to the cardiology community. So thank you, Dr. Austin, and you can take it from here.
Thank you so much, Dr. Sudhakar, and thank you all for being here. I can imagine you've all had a full day and can very much relate to carrying it all. And my goal and intention today is to hopefully allow you to set down some of what you've been carrying and allow you to kind of lighten your load, even just for this next hour or so. So let me just go ahead and dive in as we talk about the sustained responsibility that you all know too well. So I don't have to emphasize that as you're carrying it and living it. But what we're really going to dive into today is how that sustained responsibility gets held in your body and how that can impact your performance and how you're showing up in your work. So, if you'll indulge me before we kind of dive into the talk, I want you to start to notice what that means and what it exactly means to hold that sustained responsibility without always necessarily putting a spotlight on it and just getting so used to it that it becomes your normal. So, if, like I said, you'll indulge me, I want you to really allow yourself to take this time for you and let yourself kind of drop into placing down some of that responsibility. So go ahead and take a moment to just wherever you're sitting to allow yourself to even further drop into that seat. I notice you have your cameras off, so this is perfect because you can allow yourself to really have the full experience. So really allow yourself to start to feel yourself in the seat, which I know can feel kind of silly because we're just sitting in it, but I want you to start to imagine and feel that felt sense of the seat holding you up. So that might mean that you kind of drop your shoulders a little bit. You might let your back rest a little bit more into it as I'm doing now. Maybe you start to take an even deeper breath. If you feel comfortable enough, you can go ahead and start closing your eyes. Again, only if you feel comfortable, or if not, you can at least soften your gaze. So, allowing yourself to feel that the seat is fully supporting you and really noticing what it feels like to be supported by something. And before we move into this next part, I want you to just take a second to notice what it felt like to just drop for a second. To maybe drop your shoulders, drop down your eyes, feel the felt sense of the support of the chair holding you. Maybe just notice the subtle shift that maybe took place when we started versus when you felt that support. Giving yourself another moment just to really notice that. And from here, I want you to bring your attention to something that you've been carrying today. Maybe you were rushing to get on this call with me today. Maybe it was something that happened in a case, maybe something a patient said, maybe even something personal. And as you bring in that situation, I want you to notice what happens in your body as you start to think about it. Can you identify maybe where you might be holding that? Was it maybe a tension or a tightness in your neck? Or did you notice that your breathing pattern changed a little bit when you brought it back up? Did you notice that maybe you braced somewhere in your body or something felt more activated? Or maybe you noticed that your thoughts raced a little bit more. So just stay with whatever came up. There's no fixing, we're not trying to change it. Just for this particular exercise, we're just noticing. Specifically, just noticing what happens even subtly when you bring attention to something that happened earlier in your day. More specifically, I want to see if you can notice how much was already there before we brought the spotlight to it. And how much you might be carrying throughout your day without fully having the time or the awareness to connect to it. Bringing this attention to it is something we rarely get to do, especially in environments that require constant output, such as cardiology. And what you're experiencing right now, just by bringing your attention to it, is your nervous system starting to come into awareness. And your nervous system is always tracking load, even when you're not consciously aware of it. And when that load isn't processed, it doesn't necessarily disappear, it gets carried in your body, in your attention, in your decision making. So just take one more breath here. And when you're ready, you can gently bring your attention back. If you soften your gaze or close your eyes, you can now reopen them softly. Start to re-engage back in the room that you're in. So what you all got to experience is something I like to call the invisible backpack. So before you start off your day, we're all carrying this invisible backpack. It might be the weight of a patient you just had an interaction with, or maybe you're thinking about from the day before. It might be a certain decision that you made that maybe you're kind of second guessing. It might be an outcome that you're having to grapple with that maybe didn't go as you wanted it to, or maybe it did. Or there might be those systemic pressures, institutional demands, some administrative burdens, maybe just day in and day out organizational stress that you're facing. Or it might be some personal load, something that you're carrying outside of work. Maybe causes you to pause before you walk in the door. So all of these are aspects of this invisible backpack that we're carrying, not to mention if we go even further back, some of your family history or, kind of what brought you to medicine in the first place. So all of these situations are just there, and counter to what we did here, which was kind of spotlight it, it's often just kind of there in the background and doesn't really get a lot of attention unless we bring our attention to it. So before we go any further, I just want to take a moment to acknowledge Dr. Deepthi Sudhakar for inviting me into this conversation. So the work that you're all doing, the level that you're operating at, deserves to be supported in a different way, and that's my goal and intention. As Dr. Sidikar shared, my background is in psychology and sociology. My PhD is in sociology, and I focused my career focusing on human behavior, systems, and performance under pressure, especially in high-stake environments, much like your own. My work integrates neuroscience, cognitive theory load, physiology-based approaches such as somatic experiencing and polyvagal theory. Over time, that work has really focused more on medicine and those working in medicine because this is one of the highest load environments that exist. And I care deeply about this work because I've seen what happens when you continue to perform at a high level while caring more than anybody can see. So thank you again for the opportunity to share. And like I said, my intention is hopefully that you're able to take away some tools that will serve you in your day-to-day. So let's look at the data and what you're all kind of carrying with you in such a high stakes environment. So we know from the data that physicians in general and cardiologists do face burnout. So that's upper in the ranges of 50 to 60%. I don't have to be the one to tell you that higher rates among physicians when it comes to depression or suicide. And in cardiology, particularly, you're all operating in one of the highest workload and highest complexity environments in medicine. So you're feeling extra demand and extra load. So this is obviously what the research shows is this is impacting how you show up and your performance. And what I'm intending to share today is how to offset that so that you don't have to carry as much and can show up with a bit more clarity and a bit more bandwidth throughout your day, not by necessarily changing your environment, which you don't have a lot of control over, but kind of shifting that focus like we did earlier into what you do have control over. So we know from observational studies that physicians are interrupted numerous times a day, sometimes in the ranges of 9 to 12 times every minute. And each interruption doesn't just take time, it can fragment your attention. At the same time, research from Amy Arnstein at Yale shows that chronic stress can directly reduce prefrontal cortex efficiency, which is responsible for executive functioning. So what does this mean in practice? It means that your working memory can decrease, cognitive flexibility can narrow, and decision-making can become more rigid under pressure. Obviously not because of the lack of the skill that you all have, but because of the intense pressure of the load that you're faced against. And when you layer that with increased cognitive load, we see potential for error. And this isn't just how you feel, this is just the environment and the conditions that you're operating under. So where this can really have a big impact is on your nervous system. It's one of the most important aspects that I can share with you today from neuroscience, is that performance isn't just skill dependent, it's state dependent. And I'll share a little bit more about what that means. So I just want to take a moment to kind of reframe. If you've ever gone into your day feeling defeated or tired, or maybe put a lot of pressure on yourself, like, why can't I focus more? Or, second guessing a decision, or just feeling like something is personally wrong with you, I really want you to let this land that you're not failing in any potential way. Obviously, you're all extremely high achievers. What you're experiencing isn't at all a sign of weakness or inadequacy or anything to do with that. It's just an adaptation that your nervous system is doing actually exactly what it was designed to do. It's responding to sustain extraordinary demand. So let's kind of look at that further in terms of what you can control versus what you can't control. So there is this external demand, which we don't have a lot of control over, such as patient volume, acuity, time pressure, interruptions, administrative institutional expectations, unpredictable outcomes and complications. But the good news is that what we're going to focus on is that internal load and what you can focus on and what we do have some control over. So how your system is processing demand, how you can partner with your nervous system to support you, um, what you continue to carry between from moment to moment, how to work with your physiological state under pressure, and how to gain access to more clarity and flexibility and precision. So this is what I really want you to kind of take away, hopefully, and focus on is this performance triad. So I want you to think about this in kind of like a triangle or these three states, and I'll kind of bring these to life a little bit more. But there's your load, your state, which we all experienced earlier, the state that you came into this conversation with, and then maybe you had a subtle shift when you started feeling that felt sense of support of your seat. And both of those are going to impact your focus and your sustained clinical precision under each one of these loads. So let me kind of walk through this with you. So your load, let's kind of look at that a little bit more. Is anything from any interaction that you've had? So is it still staying with you? So all of those accumulated internal and external demands on you as a physician. So what is staying with you right now? So is it a decision, a concern, something that's unresolved? That's load. We know from cognitive science that unfinished tasks remain active in your working memory. So anything that you're carrying with you from case to case or from patient to patient. State, just notice your body for a moment, kind of like we did earlier. So that's your state. So even if I asked you again right now to open and close your jaw, to maybe drop your shoulders a little bit, that's that physiological and neurological condition that allows you to move from state to state. So often when we're in high acuity environments, our state is often bracing or tight or rigid, which can impact our focus. So when we relax or allow yourself to have techniques to really support your nervous system, you have the opportunity to change your state. And focus, that's where your attention goes. So when I asked you to think about your situation or something that was more top of mind, that's what you had most top of mind, or that was your focus. It's what grabs your attention. So it actually, what you focus on determines what you actually perceive. And under load, that field narrows. So this isn't theoretical, just like you experienced it earlier. It's your load and your state are going to impact your focus, which will impact your sustained clinical precision over time. So this is the model that I like to work with when I'm working with physicians or teams to help you start to get a better understanding to restore clarity under pressure. Again, where we have agency, where we have control, where we can kind of lighten these different situations. So you're going into these high acuity environments in an optimal state and supporting yourself the best possible way you can. So obviously, none of this is about your skill. You're all highly trained and highly skilled. It's that each one of these particular sections, your load, your state, your focus, and your position, is something they impact each other and they're going to impact your day to day and over a series of sustained responsibility over time without bringing a lot of attention to it and offloading some of that load and supporting your state. Then you can see how it's going to impact your day to day essentially, or how it can have the opportunity to. So intervening at any one of these points does and can potentially change an outcome. And if you probably might have questions about this, or there will be questions at the end, and I welcome them and I'm excited to open up the conversation. But let's kind of go back to that agency and give in some practical real life experiences. So let me give you like a 60-second reset, much like you did earlier, that could impact your state so that you walk away from this conversation having some tools that can hopefully from one interaction to the next give you some support for your nervous system that will kind of lighten that triangle. So let's practice these together. So the first one is going to be with your breath. So we're kind of transitioning into this experience of really allowing yourself to have a 60-second reset that you can access from here on out moving forward. So start to bring your attention right now to your breath. Just start by taking a bigger inhale and an open mouth exhale. And let's do that again. Slightly longer inhale. Hold for 5 seconds. And an open mouth exhale. And this next time you'll take the inhale, but on your exhale, I want you to double the exhale. So you'll inhale for 5, 3, 4, 5. And then you'll exhale for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So allowing yourself to exhale longer allows you to start to get back into a parasympathetic mode. You're usually activated in a more sympathetic, just high acuity, high stress. So this allows your body to naturally shift into a more relaxed state, which will access more of your prefrontal cortex, which will allow you to pause and think a little bit more clearly and start to offload what you might have been carrying from another patient or from another interaction. So now let me add to this 60-second reset. Something else you can do is I want you to bring your attention to your shoulders. We usually are kind of holding our shoulders closer to our ears, especially again, if we're more in a sympathetic or stress state. So I want you to experience what it feels like to just drop them, bring them down a little bit. Even just 5% more, you should start to be able to take a deeper breath. Starting to get, again, your state in a more regulated position and then a more heightened sympathetic stress state. So really just that gives your body the cue, which then gives your mind the ability to follow, that you can release anything that you don't need to be holding right now. So these subtle physiological cues that we're giving allow our mind to soften. It allows our thoughts to become a little bit slower or racing less, which again will give us more opportunity to access precision and clarity. So one more aspect we'll bring into, and obviously I'm going a little bit slower, but the more you practice these, you can do these really quickly, under a minute between patients or between cases, or when you have a second to just reground and allow yourself to gain what's called just more bandwidth, essentially, to think a little bit more clearly. So the next one will be with your vision. So at first we just focused on our breath, then we allowed our shoulders to drop. And now with your vision, you can do something called orienting, which you can do right now, which is just really allowing your head, and I'll do it here, to look from one corner to the room very slowly to the other corner. And this is a practice I would encourage you to do from room to room, or from patient to patient. Just take a minute to slowly scan the room. That resets your nervous system again and allows you to kind of drop into the present moment. It sends a signal to your mind that it can calm down and be in a more sympathetic state. It's essentially just widening your visual field, which is very supportive for your nervous system. And the last aspect of this 60-second reset is connecting to the physical support. So I did that for you at the beginning. We did that with your chair. If you happen to be standing, you can just do that with the floor. You can really press more firmly into the ground, and that anchoring again brings you more into a parasympathetic, which is really just allowing for that sustained precision over time. And I'll share these with any of you if it's helpful, but the second 60-second reset, excuse me, is your breath, your shoulders, your eyes, widening your field, and then the felt sense of the floor of that support. And you can do that really quickly in under a minute. The more you do it, the more intuitive it'll feel, and the more you'll just naturally do it. And it's really the compound effect over time. The compounding over time is what will really benefit you and will really let you place down the load that you carry so much throughout your day, and obviously throughout your week, and the cumulative effect of that over time. So let's look at a case study, what this looks like in practice when we bring in some of these supports to support your state and what this can look like. So as an interventional cardiologist, you're handling complex, high-stake cases. And you're really performing at a high level externally. So you might be highly respected by your peers, which I'm sure you all are, trusted by your patients, maybe um, meeting benchmarks. So this is an example of physicians I've worked with in the past, but internally you might be feeling a lot of mental fatigue. You might be really second guessing some of your decisions, some of your calls. You might start to feel a little bit less clarity or a little bit more foggy under pressure. And you might feel like you're having to exert even more effort to stay present with patients. So this is an example of, even though you're performing really well externally and you're able to do that over time, there is an internal cost that is happening. However, when you start to really partner and support yourself through these practices, you'll start to have more increased, clarity, confidence, and communication. So what this specifically looks like is, with the clarity, you might start to gain access to faster, more acute decision making and high stake moments. Confidence, you're having less doubt, and you're just bringing in greater trust in your clinical judgment without second guessing under pressure. And in communication, you start to feel more effective, more regulated with patients and families and colleagues. So again, this is the compound effect of doing this over time, going back to that triangle where you're lightening your load, really allowing that compound effect of your state, which is going to greatly impact your focus and how you show up from case to case. And this goes beyond just your own experience. This actually also translates to clinical outcomes. So your own state will impact clinical performance clearly, which can impact patient outcomes. So these are all impacted and will have an effect over time on patient outcome. So hopefully this gives you a small glimpse at nervous system support and the work that I do with physicians. You're obviously all highly trained and highly skilled and know how to really kind of get through and grit through and bring a lot of resilience. And what I offer is further support so that you can place down some of the daily burdens that you might be carrying, that obviously you know that you are, but may not have the time or the support to be able to shift that attention in subtle ways that you can support yourself. So I will open it up to questions or any comments, or if any of this is resonating. So it's not that you don't need to carry less responsibility. It's just that we need to learn how to put down what your system was never meant to be carrying continuously for so long and so chronically. So I'll go ahead and open it up. Thank you so much for letting me share more on this. But I'd love to kind of dive in to see if you have any thoughts or questions. And you can stay off camera or on camera, whatever feels comfortable for you. Hi, Janet.
Hi, thank you so much for sharing this with us. I think it wasn't until you said like unclench your jaw and like bring your shoulders down did I really realize how much tension was still in my body, even though, we were going into this session to kind of really focus on ourselves. So thank you for that. And I think these are valuable tools, and we probably just don't use this enough, right? We're just go, go, go. Um, and thank you, Dipti, for connecting us to Erica, because it's just as you said, we are busy clinicians and trying to do the best for our patients and teams. But when it's, that cumulative load that builds up, and particularly when there are things that are left undone or incomplete, notes that are
Yep.
incomplete, or all the various things that each of you deal with. This is important. So thank you.
Yeah, thank you so much for sharing. I really appreciate your feedback and just the noticing of when you unclenched your jaw. And that's exactly it. We're often holding so much that we don't realize and don't kind of give ourselves that opportunity to set it down, and more importantly, to feel the effects of being able to do so, especially in a more kind of continuous compound way. So thank you so much for sharing your experience, Janet. I really appreciate you being here and sharing.
You have tips that help clinicians remember to, I mean, we tell our patients actually, right, to
Yeah.
take a deep breath, do kind of that yoga style breathing to, activate that parasympathetic nervous system.
Yeah.
But we don't always do it ourselves. What are
100%.
some of your suggestions?
Yeah. Thank you for that question. A big one is getting yourselves support. I mean, you're all doing such amazing and obviously high stakes life or death work that often it can feel like you may not have the time to support yourself, but this is work that you can really integrate throughout your day. So what I would recommend, Janet, is just to have maybe more accountability, someone that can support you while you're supporting so many lives, so that you can then gain these tools in a deeper way where they start to feel intuitive, and where you're not starting to, or you don't feel like you constantly have to remind yourself, but they become second nature. So that would be my biggest recommendation, if you were to take one, was to give yourself the gift of support so that you're not carrying it all alone.
Thank you.
Of course.
Thank you so much, Dr. Austin. I think what struck me was that it didn't take very long to get present, get centered. I think sometimes there's this feeling that you need to meditate for 30
Mhm.
minutes in an hour, and do that consistently every day to be mindful, which is not always realistic in our roles. And simply just spending 60 seconds wherever you are to feel the ground, feel the seat, and ground in that moment, how much of an impact that alone can make in clear in giving more clarity, and like you said, increasing your bandwidth. So I really appreciated that part of it.
Yeah, absolutely. Like you were saying, and the more you do it, the more intuitive it becomes, and then the more access you have to parasympathetic, the more you're just kind of bringing that into every interaction. As you were saying, Janet, you'll start to notice that you're just more open, less restricted, less tight, less kind of back there or over there, but more here. And usually, patients will really feel that as well. And it's those 60-second resets, like you're saying, Deepti. It doesn't have to be a long 30-minute meditation, but it is a compound effect of doing them whenever you can.
Are there any other questions in the crowd? Any feedback?
While people are thinking of questions, Deepti, as a interventional cardiologist, is this something that you practice like before each case or after each case, or can you share maybe, I know it's a little bit more getting a personal question, but
Yeah, yeah.
how maybe more procedural oriented physicians can take advantage of these tools?
Yeah, so I have started using some of these tools when I am in a case and I am waiting for my tech to bring me my next balloon, bring me my stent, which is sometimes on the other side of the building, it feels like. And I'm waiting for the ACT machine to be done running, all those brief moments where you just want to keep going, get through the case. And you're feeling like the anxiety and the frustration sometimes. Those are times where then I've learned to, okay, pause. Can you just do 3-part breathing, lengthen your exhale, um, and then that time goes by. So those are small ways that I've incorporated it in my day to day.
Great, thanks for sharing.
But yeah, I think we all know the data about stress and burnout, particularly in cardiology. But I think there's a gap between knowing that data, knowing that there's tools. I think we're all very well aware of you can do yoga, you can do breath work, you can do meditation, but that gap in how do I bridge that gap and now apply it and make it work for me and my lifestyle and what I do. So I think having tools like this is just nice to have these options.
Yeah, and I'll just share, obviously, this is kind of at a very high level, you know, bird's eye view, so to speak, but I know that each of you are carrying so much in your day to day, kind of going back to that invisible backpack, and there's so much that needs to usually get unpacked. We can kind of start to feel a little bit more relaxed when we, like you're sharing, Janet, just notice your jaw. But often we're all carrying quite a bit in that backpack, and often um, it's hard to make the time to maybe start to unpack some of the things that might be there that might have led to more chronic stress, or maybe stress that we may not have had the time to look at or unpack. So I just wanted to name that because while these are kind of simplified, easy tweaks that I've shared today, I also don't want to dismiss that. This can be a lot more complex and complicated, especially because we're all so dynamic, and all of you are carrying such heavy work, that often it can just require, some support and unpacking what that might look like on a clinical level. And also, it can often also bring in a personal level because we're humans and we're dynamic and there's a lot that we bring into our work as humans. So it's just having that space to set that backpack down and maybe, unpack it one layer at a time.
Well, thank you so much. If there are no other questions, I think we can transition out. Rasheen says, thank you. Thank you all for logging in on this Thursday afternoon. Dr. Erika, are there any last thoughts, anything you want to share with us?
Yeah, thank you all for being here. If you want to continue the conversation, there's my email. It's easy, Dr. Erika at drerikaustin.com. If you have any questions or want to explore what working one-on-one would look like, or bringing me into your teams or some speaking, I'd be happy to explore that with you. But I hope that you take away the 60-second reset with you and hope to start to put this into practice, and whether it's with me or somebody else. I hope that you all support yourself by unpacking some of that backpack and lighten your load wherever you can. But thank you for being here. I know you're all busy, and so appreciate your presence and your time. So thank you.
And thank you to the California ACC leadership team for making this possible. I
Yes.
think this is such an important topic, and it's great to have this platform to discuss it. And look forward to seeing everyone at the conference in a couple of weeks.
Yes. Thank you all for having me and for being here.
Thank you so much. Really appreciate you bringing these sessions together for us, Deep Deep. We really appreciate, the time that I know often to kind of set aside, this very important self therapy. I mean, it's really self-care, right? So probably don't emphasize it enough in our day to day. All right. And thank you so much, Dr. Austin. We really appreciate this advice. This is going to be recorded. Well, this is recorded and will be on our website for everyone to click back in. So thanks for that. And I think, is it Leanna who's on the other line? Thank you, Leanna, for always your support. Or maybe, I'm not quite sure who was on, who logged in for California ACC. Have a good night, everyone.
Thank you.
Thank you.
Bye.
Bye.